Hi, thank you so much, Jackie and Sky, for that really heartfelt presentation. And indeed, we cannot talk about multiculturalism, diversity, and inclusion unless and until we are working together at recognising and undoing the injustices done to the traditional custodians of this country called Australia, and by supporting a treaty their way. Australia is the only country in the world without a treaty with its Indigenous people. Now, harmful use of alcohol and drugs and other unhealthy behaviours such as gambling is a problem that impacts all parts of Victoria's diverse population, including people from migrant and refugee backgrounds. Indeed, migrant and refugee communities can be particularly vulnerable to alcohol and drug as well as gambling harm because of their experiences of trauma prior to migration, as well as the challenges of settlement post-migration, social and economic marginalisation, and experiences of racial discrimination, which can be exacerbated by other aspects of the migrant experience, such as social exclusion, unemployment, language barriers, financial stress, housing crisis, and also a lack of culturally appropriate services and supports, which have been linked to poor mental health and well-being and can lead to harmful use of alcohol and drugs. It's therefore really important that migrant and refugee communities are able to access alcohol and drug and other community support services, as well as being educated about how to reduce alcohol and drug harms. Like our Indigenous communities, members of the migrant and refugee communities are significantly underrepresented in the use of alcohol and drug and community health services. The most recent statistics show that 81% of users of alcohol and drug services were born in Australia, and that 95% reported speaking English as their first language, whereas only 28% of Victorians were born outside of Victoria, and 26% speak a language other than English in their home. Whilst mainstream services have a safe and inclusive policy, they only meet the needs or give access to certain types of bodies or identities while harbouring a denial of service policy for other bodies or identities. For example, in Western cultures such as Australia, the dominant narrative or the normative is assumed to be a white heterosexual middle class, male or female, able-bodied from middle or upper socio-economic class with full citizenship or permanent residency. All other bodies start at a deficit. Some migrant and refugee communities don't see themselves represented in mainstream services in any way, and there is a fear and mistrust of what services might do with their personal data collected through the really, complex and intrusive assessment intake forms. Even the physical environment alone can be threatening for some and bring up past trauma. If you don't have English as a language, you can't access rehabs because rehabs are designed, they're based on group work, actually. And because of the intimate space that has been created, bringing in an interpreter will break that dynamic. And of course, there's layers of, issues around privacy and confidentiality. Also, some of the men's behaviour change programs are limited to 3 languages at the moment, which can severely impact families who have someone mandated to do a men's behaviour change program. If there's an intervention order in place, there's no access to the family whatsoever until they have done the men's behaviour change program, which is really tricky. Having to stay in a hotel or find other accommodation makes it really difficult for people. Women using alcohol and drugs cannot access crisis centres unless they have been abstinent for a minimum of 3 weeks. So as you can see, a lot of our community service sort of work in silos, which make our service system incredibly complex and difficult to navigate. Also in mainstream services, a lot of families are really left in the dark, and they felt like they cannot be involved in their loved one's journey. Of course, the concept of privacy and confidentiality is really important, and we do take that seriously. However, in mainstream services, they don't understand the importance of culture, spirituality, working holistically with the family, and how many people using harmful behaviours really do want family involvement. And just by articulating that, we uphold privacy and confidentiality and we don't share your information, sometimes that's misunderstood as in you cannot have anyone else involved in your recovery journey. And families are at a loss. They feel helpless because often migrant and refugee communities really value family, and it's an incredible part of their life. Families are an incredible part of life, and not being able to support your loved one can bring about a sense of helplessness and hopelessness and really divide the family. So sometimes what can be helpful is not to disclose personal information, but, to always have that invitation and using language that suggests or invites families to be involved where it's available. Like, I understand that for many users, that might not be an option straight away. However, we keep putting out the invitation so that hopefully at a certain part of, or at a certain time in a person's journey, they might allow the family in. And with regards to family, helping them understand what are drugs, what are harmful behaviours, because, I have spoken to many migrants, and for them, being in their country, just surviving, smoking was their coping strategy. For example, they had no idea of drugs. They don't know what drugs are. And smoking was their go-to. Now, smoking is very cheap in a lot of their countries. But when they come to Australia, they were shocked to see the prices, the tax, of cigarettes. And so a lot of them couldn't afford cigarettes. They had to go cold turkey because they had no idea of how to quit, how to withdraw safely. They have no idea about the recovery journeys that could be available for safe withdrawal from cigarettes. And so many have gone to drinking alcohol, cheap caskets of wine that they could get on a supermarket shelf. Some migrants who have been stripped of their qualifications, and a lot of them have been, very qualified, said they feel like thieves coming to Australia because they've had to work for cash in hand jobs, just any random mediocre jobs to make ends meet. They value education. They actually used to support other people, and they're a dignified people. To have to put out their hand and ask for charity and rely on charity from community is a big deal. So everyone's dealing with it in their own way. Dad might be gambling on the side whilst drinking that cask of alcohol, cheap wine, hoping to make that big win so that he can support the family. Mum might be self-medicating, taking painkillers, taking sleeping pills, maybe seeking anxiety or depression medication without really disclosing to the GP everything that she's taking to cope. I've had children that have disclosed, or adult children that have disclosed that they've been exposed to weed as a gateway drug and now on ice. And I've had some mums say to me, Manal, what's ice? How can the ice in the freezer impact my child? They have no idea what's going on, absolutely none. You know, one mum said to me, why is my 15-year-old playing with balloons? What are these little canisters? And, you know, she wasn't aware that her child was using nitrous oxide and using the balloon as a way to inhale or take in the nitrous oxide. So there's many layers, and sometimes just talking to what recovery journeys look like, giving families some psychoeducation, what to expect can be really helpful. I mean, you know, families need to feel safe when engaging, you know, with service providers. Part of the solution is the employment of culturally bilingual liaison peer support workers, people who are key in supporting people from marginalised communities, and who can be a link to community and can provide training and support throughout the alcohol and drug journey, and to increase culturally safe practices. You know, if people feel safe accessing treatment, they'll be more likely to reach out for help sooner. I guess, as we lobby for government bodies to capitalise on existing culturally specific alcohol and drug programs, they do exist, although they are underfunded. And one such program is a program I work for called the Muslim Youth Adult Family Services. It's the only model of its kind in the whole of Australia, and it is part of a consortia of 5 major mainstream services, such as SHARC, the Self-Help Addiction Resource Centre, Odyssey House, YSIS, which is a youth service, Salvation Army, and Uniting. And of course, my centre Support Services, which is an Islamic organisation, which really this was born from that organisation. It was the brainchild of this My Centre Support Services. Now, you know, our physical environment represents the community we're representing. We have verses from our Holy Quran on the walls that talk to hope and forgiveness. We have 3 counsellors. We're all bilingual workers. We speak multiple languages, so collectively we cover Lebanese, Turkish, Somali, Egyptian, Sudanese, French, and English. We have a GP, an Indonesian GP, and an Australian nurse on site. People see themselves represented in the workforce when they come through our doors. And even though 75% of our cohort or service users identify as Muslims, many, over 25% are just from multicultural communities, but they feel safe walking in our services. You know, we do work unconventionally. We simplify the long, complex intake process usually associated with mainstream services. We work holistically together to support the family unit, flagging family inclusion every so often, because evidence does overwhelmingly suggest that when family is included, it does lead to better outcomes in a person's journey. Again, we educate family members on what to expect, what their person might be going through, the impact of drug and alcohol and gambling harm. We look at what might be the root causes of this, what are the different patterns. We talk about dual diagnosis, mental health, the stages of change, how to say no. We support them with boundaries. What are intervention orders? What's the legal system look like? What's helpful? What's unhelpful? We try and break down that stigma and shame associated with drug and alcohol or gambling or mental health. We explore the family members' adaptations or coping strategies for dealing with chaos in their lives, because often they're fixated on their loved one's journey and they're oblivious to their own coping strategies. So as I mentioned earlier, we'll look at the psychosomatic symptoms, alcoholism, gambling, isolation. Like, what are the families doing? What is each member doing to cope, and might not even realize that they've developed an unhealthy habit themselves. And we unpack that with some psychoeducation program and talk about the body and the stresses on the body and how they might be coping. At MYAF, which is an acronym for the Muslim Youth Adult Family Services, we use a cultural trauma-informed lens, which is respectful of the health beliefs, practices, culture, language, and faith of diverse populations. We often get feedback that our service is safe, accessible. Of course, it's free of charge, hence affordability. And that we as peer workers, all of us have our lived experiences, are approachable, acceptable, and accommodating. We work with families towards their personal recovery, which means supporting them create and live a meaningful and contributing life that suits them in a community of their choice. We consider how culture shapes the expression of social issues, how they are experienced, modes of coping, pathways to care, and the effectiveness of treatment and prevention, as well as the process of resilience and recovery within their own community. We're open to non-traditional forms of recovery and pathways that may seem unconventional. For example, there was a lady that came from Eritrea, and she had 2 adult sons that were impacted by drugs. And she took one to Eritrea and gave him nothing but camel's milk 3, 4, 5 times a day. Every meal he was having camel's milk, which gave him diarrhea and made him vomit because he wasn't used to the camel milk. And she said that after 2 weeks, he no longer craved drugs, the drug of his choice. That cleansed his system. And so when her other son was in detox, in one of the detox places in the city here in Melbourne, she wanted to get this son over to Eritrea. And whilst her son was on the last day of his detox, she spoke to his care team and said, can they please hold him for another couple of days while she booked tickets and organised the trip overseas because of this effective treatment with camel's milk, because she was scared he'd relapse when he went back to his environment. And this particular detox place had very accommodating, culturally responsive workers, and they supported this mum in allowing her son to stay for another couple of days. And they actually assigned a couple of peer workers to escort her to the airport with her son to get him overseas, because for them it's all about good outcomes. And if she thought that that worked for her son, then they supported her in that journey. At MYAF, we have people that want to start off with Quran readings by someone that they feel is a spiritual person. So we've organised that for them as well. Someone wanted to go back to their country because their mum had, this is a young person that said that his mum had mental health issues and felt he was being abused in the home, and he felt safe with his auntie and cousins overseas and was drug-free for 2 years when he lived in Turkey. So the community saved money and we sent him overseas. So this is the type of stuff, like, we're open to this kind of stuff, whatever works for the family. I believe it is the ability, to communicate with, effectively communicate and interact with people cross-culturally, which includes more assertive outreach. For example, people might feel the stigma of being seen walking into our service, or there's a lot of shame in the community. You know, in a lot of faiths, especially the Muslim faith, and I'm sure in a lot of other faiths as well, because I've had this conversation with many people from diverse faith backgrounds, drug and alcohol and gambling are seen as sins. So a lot of the faith leaders just shove it under the carpet and they don't want to talk about it. Or they say to the person, you're sinning, there's no hope for you. And so that person just goes deeper in their unhealthy coping habit. And mental health is seen as a weakness in faith. So again, families really try hard to sort of like cope on their own within their family walls because they're scared of being shunned or ostracized from their community. And if coming into our service is going to be a barrier, then we'll meet them. We'll go to their home, we'll go to the park, we'll meet them at the gym, we'll meet them for a coffee in a coffee shop, whatever it may be to break down those barriers for them. We found that using interpreters can be quite challenging because sometimes interpreters will put their own spin or they're very directive and they don't necessarily interpret everything that we say. All those connector things that we use, that language to connect with people, interpreters don't use that. They just go to the very, they become very directive. And sometimes some communities are from a very, they're a very small community, and using interpreters can risk the privacy and confidentiality of certain families. So wherever possible, we try and use interpreters from other areas or someone that might speak the language but not from the same community. And where possible, we try and use bilingual workers from the service sector that actually understand what the person might be going through. With regards to being workers, we all have our own judgments and biases. They're involuntary, like we all have them, and we cannot know everything. So understanding that people are multifaceted, complex cultures within themselves, being aware of our own biases and the power dynamics is really important. Being transparent, authentic, and curious creates better relationships. And building strong connections, listening deeply, will lead to honest, open communication and engagement. That's why we don't do the assessment process, the first visit. Like, we take time and thank God that we have that ability within the MyAF team and the service, that we understand the importance of connection and building rapport and creating that safe space. So we can do an assessment over weeks, as long as that person is comfortable. And also it's important to also know that just because I might be from a particular community or ethnicity, cultural or religious background of a particular person or family I'm working with, I can't assume that I understand their journey or I understand their values, because our values might be far apart. They might not be aligned. And being able to just sit and talk and understand with a person as to what their beliefs are, what they want to do, is really important in the way we work with our service users. And as a team, we're constantly self-reflecting and co-reflecting, as part of a commitment to lifelong self-critiquing what could be done better and recognizing and challenging the power imbalances for service users and ourselves in a professional setting. We endeavour to collaborate and develop partnerships with community and community leaders, because often faith leaders and community leaders have these huge platforms where they can use their ceremonies and places of worship to break down the stigma and shame associated with drug and alcohol and gambling and all these other social issues. So we work together to educate faith leaders and community leaders in supporting community because, we're all human and we're all going to fall, and we all use the tools we have at the time to cope. And sometimes we need professional support. So we educate faith leaders and give them resources into how to find referral pathways and make those warm referrals to us or other services that they feel might be beneficial to services. Even though, I think we still have a long way to go with mainstream services being more culturally safe places, being more culturally responsible, displaying cultural humility when working with people from marginalised communities. There is a positive. There's actually a few positives. We are heading in the right direction here in Victoria. The government does value the lived and living experience. I guess, what can I say? The lived and living experience. Yeah, so they've created departments of task forces, and they're educating and pushing to have peer support workers across the health service sector, whether that be alcohol and drugs, gambling, mental health, family violence. And they've seen the benefits of that, now creating free education through their TAFEs, through colleges, in offering peer support career pathways. And that's a huge step for the sector. There's also family and carer hubs now called Connect Hubs. I think there's 8 in Victoria, 4 rural and 4 metropolitan, along with many satellite family and carer hubs, because families and carers need support, and it's welcomed. And I look forward to lots more positive change and being part of the change that I'm witnessing right now. Thank you very much.